Welcome back to What's Now. Cancer diagnosis is absolutely devastating, and what do you need to know if you get a prostate cancer diagnosis? Well, we found out what you should do, what you should ask, and who you should seek help from. Let's take a look.
Receiving a cancer diagnosis is one of the most terrifying experiences someone can have. Unfortunately, 1 in 9 men will receive a prostate cancer diagnosis. Joining us to discuss what we need to know is Dr. Stephen Finkelstein. Thanks for joining us, Doctor.
It's a pleasure to be here today.
So how common is prostate cancer?
Prostate cancer is the most common non-skin cancer in American men. In the United States, as you said, about 1 in 9 men will get diagnosed with prostate cancer. The good news is that prostate cancer is highly treatable, and there are several treatment options available based on a person's age, their health, and personal preference. I'm excited about the ability to talk with you about these treatment options today, and that's why I'm so pleased to partner with Boston Scientific on this educational campaign.
When should men get screened for prostate cancer?
Deciding to get screened for prostate cancer is a personal decision made after consultation with a doctor. Some of the important factors to consider as a patient are your age, your family history. Now, detecting prostate cancer early gives you as a patient the best chance of living longer. Indeed, in fact, more than 99% of men survive prostate cancer when it's caught early. In my own personal experience, my own father was diagnosed with prostate cancer 10 years ago. He received radiation therapy, and I'm happy to report he's doing very well.
What are the treatment options, and have there been any recent advances in treatment options?
Yes, so treatment options for prostate cancer include active surveillance, where we monitor the cancer and do consistent testing to see if symptoms change over time, or surgery to remove the prostate, or radiation therapy to shrink it. And each has its own risks and its own benefits. Interestingly, the most common approach for older men is radiation therapy. And many of my patients are often very concerned about side effects. What I tell my patients is that in order to reduce the risk of potential rectal damage associated with radiation therapy, physicians can use something called space OAR hydrogel that creates a temporary space between the prostate and the rectum. The presence of this gel, which is inserted via a minimally invasive procedure prior to radiation therapy, is designed to reduce radiation dose to the rectum.
And is it safe for men to visit their doctor to discuss prostate cancer treatments, especially right now?
Yeah, clearly 2020 has not been the year many of us expected as either doctors or patients. Physicians' offices, hospitals have begun taking extra precautions due to COVID-19 pandemic, and many locations have safely resumed elective procedures. Talk to your doctor about the precautions they are taking on site. And together, you as a patient and your doctor should determine the best time for you to hear about and the best time for you to receive treatment. My personal experience is that patients have been seeking and that patients have been receiving care just fine.
And where can we get more information?
For more information for those who are discussing radiation as a treatment option for prostate cancer, you can go to spaceoar.com, a resource provided by Boston Scientific.
Well, thank you so much, Dr. Finkelstein, for joining us from Florida and giving us this important update on prostate cancer.
An absolute pleasure today.